Hello everyone, my name is Daniela and I'm a volunteer at For a Safer Space. Today's presentation will be part one of a two-part presentation on substance use. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use a land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Our agenda for today will include the following: an introduction, a breakdown of substance misuse, abuse, and addiction, the substance use spectrum, statistics, substance use disorder risk factors, substance use disorder warning signs, comorbidity and substance use disorder, how does substance use impact the brain, treatment, some resources, and then finally it will conclude with some key takeaways. As mentioned, this presentation will consist of two parts. Part 1, this video, will focus on certain topics that outline the details of substance use and substance use disorder. Part 2, the next video presentation, will discuss different topics pertaining to the subject, following social justice, coping methods, and supporting others. To begin, substance use is a serious issue that impacts many individuals. This occurs when individuals utilize alcohol, prescription medications, or other legal or illegal substances too often or incorrectly. There are different types of substances that may be abused, including alcohol, prescription or over-the-counter medications, legal or illegal substances, and cigarettes. There can be various signs that substance use has become an issue. For some, substance use can become a substance use disorder. However, there can be certain risk factors that can lead to substance use disorder. All of this will be discussed in more detail in following slides. Over the next couple of slides, the differences between substance misuse, abuse, and addiction will be highlighted and discussed. It is important to note that while these terms are commonly used to differentiate where someone is on the substance use spectrum, activists are moving away from language such as substance abuse. Language and substance use will be discussed in part 2 of this presentation. As there can be similarities in people who use substances, many individuals use these terms interchangeably. However, as there are varying differences between each and what strategies work to support these individuals, it is important to understand the differences. First, we'll discuss substance misuse. This is generally thought of with regards to prescription medications, when individuals go against the recommendations of a doctor for how to use a particular medication. It is important that medications are taken as directed, as there can be negative side effects. This becomes substance misuse when these substances are utilized in a way that goes against what is recommended. For instance, this occurs when an inaccurate dose is taken, they are taken at the incorrect time, doses are skipped, the use of a medication is stopped early, they are taken for a reason other than why they were prescribed, or someone takes a medication that was not prescribed to them. Next, we'll discuss substance abuse. This occurs when drugs or alcohol are misused for reasons of self-harm or the feeling of being high. This can also be known as substance use disorder or SUD, as individuals who use substances can experience changes in thinking, behavior, and bodily functions. As well, it creates difficulties with impulse control. And finally, there's substance addiction, which is also called severe substance use disorder or severe SUD. This is a mental illness where substance use becomes uncontrollable regardless of its consequences. There becomes a physical and psychological need to utilize substances due to the severe withdrawal symptoms that occur without them. While there are overlapping similarities between these terms, there are a few key differences. It is because of these differences that it is key that we do not use these terms interchangeably. Therefore, we need a better understanding of the differences so that we can better differentiate which term is applicable when. First, we will discuss the differences between substance misuse and substance abuse, or SUD. This comes down to the individual's intent when utilizing a substance. For instance, in the context of sleeping pills, substance misuse would be seen if someone cannot fall asleep and they chose to use another pill in hopes it would work. SUD in this scenario would be demonstrated if the intent is to manage moods or attain a specific feeling. There are also differences between SUD and addiction or severe SUD, as severe SUD tends to be more extreme. For this, the difference lies in control they have over themselves and their life. Specifically, an individual who uses substances under the categorization of SUD won't experience major problems in their life. However, those with severe SUD live with a mental illness that will greatly impact their life in various ways, such as missing school or work, endangerment physically or financially, or experiencing other problems due to substance use. However, even knowing this, they cannot control their substance use in order to benefit their situation. This also demonstrates why many people with SUD tend to lose their jobs, homes, or are separated from family. Substance use spectrum. Substance use can be seen through a spectrum to better understand why people use substances and to what degree they may use them. For many, there may not be any issues regarding their use. However, for others, it can have severe adverse effects. People can even flow throughout this spectrum. Specifically, someone may not use substances in a concerning way during one point of their life. However, during major times of stress, they may begin to use substances. This shows the connection between substance use being reliant on an individual's lived experiences and their behavior. The image shows 4 different spaces along the spectrum: beneficial use, casual non-problematic use, problematic use, and chronic dependence. Beneficial use is substance use that positively impacts health, spiritual needs, or social life. Casual or non-problematic use is recreational use that has insignificant impacts on health or social life. Moving along the spectrum is problematic use, which is use that starts to have negative impacts on the individual, their loved ones, or society. And finally, there's chronic dependence, which is use that is habitual and compulsive regardless of the adverse impacts on health and social life. What is important to remember with the spectrum is that people may not stay in one place. They can move to the right of the spectrum and move back to the left. Now we will go over some statistics to demonstrate how greatly substance use can impact individuals. Roughly 5% of the population globally have utilized illegal substances. Keeping with international statistics, about 240 million people are said to have misused alcohol. Within Canada, about 21% of the population, or about 6 million people, will meet the criteria for SUD in their life. Alcohol appeared to be the most utilized substance in addiction, with 18% of the population. While many individuals can use substances recreationally and without any severe harms, many individuals can experience substance use issues. For instance, in Ontario, about 10% of the population is said to have misused substances. This is even demonstrated through the rise in problems surrounding opioid use. The opioid crisis will be discussed further in the next presentation. Similar to other mental illnesses, SUD can have various risk factors that can increase the chances of developing it. We will discuss a few of them. The first being family history of substance use. SUD can actually run in families, and research shows that there can be a relationship with genetics. For instance, if there is a relative someone has a biological connection to with SUD, they can be more at risk for developing SUD. The next risk factor is mental illnesses. The prevalence of other mental illnesses such as anxiety, depression, attention deficit hyperactivity disorder or ADHD, and post-traumatic stress disorder or PTSD can increase the risk of developing SUD. This is because it can be used as a way to cope with the symptoms and feelings associated with these mental illnesses. However, often it increases the symptoms. More about this relationship will be discussed on a later slide entitled Comorbidity and Sud. The next risk factor is peer pressure. Peer pressure can greatly impact the probability of developing SUD. This is especially prevalent for youth. As well, there are family problems. Issues with family or a detachment from family can add to the risk of SUD in youth, especially considering in many of these instances, youth have less supervision or are more isolated. Early use. Utilizing substances at an earlier age can actually lead to an alteration in the brain as it's developing, adding to the risk of developing SUD. And finally, using highly addictive substances. Sometimes substances used can be more addictive than others and can lead to a quicker development of addiction. SUD warning signs. It can be common for people living with SUD to mask their symptoms. However, there can be some warning signs to look out for. These can be categorized into 3 different groups: physical, behavioral, and psychological. Physical warning signs include differences in eating or sleeping habits, changes in the appearance of the eyes such as bloodshot eyes or changes in the pupils, changes in physical appearance, sniffling, tremors or impaired coordination, and changes of smells on breath or clothing. Behavioral warning signs include The use of substances impacts relationships. An individual may appear more secretive. They may engage in illegal activities such as driving under influence. There may be sudden changes in social life. Heightened drug tolerance. Misuse of substances for avoidance of any withdrawal symptoms. There may be loss of control over substance use. Someone may leave behind enjoyed activities. And finally, there might be continued substance use regardless of its impacts on their life. To continue with warning signs of SUD, we will discuss the psychological warning signs, which may include emotions of fear, anxiety, or paranoia for no particular reason, changes in motivation, an increase in exhaustion or spacing out, times of heightened energy, nervousness, or instability. There may also be sudden mood changes, heightened irritability, or anger, or even changes in personality with no known cause. It is important to note that warning signs can fluctuate depending on the individual and which substances are being used. This next section will discuss comorbidity and SUD. However, I think it's important to have a foundation of knowledge on what comorbidity is. Comorbidity can be defined as the prevalence of two or more illnesses in the same individual, either co-occurring or one after the other. There can also be an interaction within the illnesses that can negatively impact both. Now that we understand what comorbidity is, we can look at the connections between other mental illnesses and SUD. It is actually quite common for individuals living with SUD to also have another mental illness. Similarly to having another mental illness can put someone at an increased risk for developing SUD. For instance, approximately 50% of individuals living with mental illness will also live with SUD at some point. A few studies have been done on comorbidity in youth. Findings suggest that those with SUD have significant rates of comorbidity with other mental illnesses, including anxiety and depression. But why does this occur? Current research suggests that there are 3 different reasons that this may happen. The first being that risk factors can contribute to both other mental illnesses and SUD. Genetics can play a major role in the development of both mental illness and SUD. Not only can genetics increase risk, but they also factor into how someone responds to a substance. Research even suggests environment can create genetic alterations that impact generations. The second one is mental illness can play a role in substance use and eventually SUD. Some mental illnesses are risk factors for SUD, especially considering some may use substances as a form of self-medication. Brain alterations with mental illness can create the rewards impacts of substance use, creating repeated use of a substance. And finally, SUD can play a role in the development of mental illnesses. The use of substances can alter the brain to make a person significantly more likely to develop mental illness. More on these changes will be discussed on the next slide. It is important to discuss the relationship between mental illnesses, as it is a significant point in the discussion and understanding of substance use and substance use disorder. How does substance use impact the brain? During this presentation, brain changes were discussed in minimal details, but the changes in the brain can be major, especially in the development of SUD. Therefore, to be discussed will be the size of rewards and withdrawal and how this impacts brain processes. It is important that we understand this, as if talking or supporting someone living with SUD, it can be critical in leading with empathy and compassion, as we can see why there is continued use of a substance. The first aspect we'll talk about is rewards in the brain. Substances can impact the brain to increase significant feelings of feel-good emotions or the chemical dopamine, which impacts the mind and body. Therefore, individuals continue to use substances for this chemical that the brain releases, which creates a cycle. Over time, there is tolerance for these substances and the rewards taper off. However, the individual requires the substance to feel at their baseline or normal. This takes us to the second point, which is withdrawal in the brain. Due to the use of substances, people feel the rewards. However, as the substance wears off, there are withdrawal symptoms, which reinforces the continued use. If there is a sudden halt to the use of substances, there can be severe mental, physical, and emotional results. Withdrawal symptoms can vary depending on the substance. This is because the brain, which became tolerant and reliant on a substance for normal functioning, is being deprived of the substance and ends up rewiring itself. However, withdrawal symptoms often need some form of professional attention to lessen the risk of relapse or negative health consequences such as a stroke or a heart attack. There are a few options for treatment for SUD, and we will discuss a few of them. However, part 2 of this video will highlight harm reduction and discuss that in detail. The first treatment is detoxification. This is medically assisted programs that will help someone overcome the symptoms of withdrawal. It can be over the course of a few days or even weeks. Often when this is done, people opt for inpatient rehab. Inpatient rehab programs are live-in solutions where individuals get structured care plans that will help overcome substance use. This can take weeks or months depending on the individual. The next option is outpatient rehab programs. This consists of therapy and treatment on the individual's own time on a regular basis. Then there's psychotherapy. There are different types of psychotherapy that can be used for SUD, with the most common form being behavioral therapy, which is often used during rehabilitation. Other psychotherapy modalities include cognitive behavioral therapy, or CBT, individual, group, or family therapy, dialectical behavioral therapy, or DBT, or rational emotive behavioral therapy, which is also called REBT. As each psychotherapy modality has different focuses and approaches, it is significant that individuals find one that works for them and will support them best. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some key takeaways. While similar, there are differences between substance misuse, abuse, and addiction, which are significant to understand as the severity of the circumstances differ. With substance misuse and abuse, the difference is intent. With substance abuse and addiction, the difference is control. Substance use can be viewed on a spectrum, and individuals can fluctuate between their placements on the spectrum. There are various risk factors for SUD, including family history, mental illnesses, peer pressure, family problems, early use, and the use of highly addictive substances. To continue with some key takeaways, there are different warning signs for SUD, which can be broken up into 3 categories: physical warning signs, behavioral warning signs, and psychological warning signs. It is important to understand the prevalence of comorbidities between SUD and other mental illnesses. There are a few ways that substance use can impact the brain, leading to cycles of addiction, mainly through 2 processes: reward and withdrawal. Treatments for substance use disorder include detoxification, inpatient or outpatient rehab programs, and psychotherapy. To continue with this topic, the next video will touch on substance use as well. Rather than from a detailed point of view outlining what it is, we will explore ways of coping, supporting, and social justice, and how this is applied to substance use. That concludes part 1 of the 2-part presentation on substance use. Thank you for watching.